Good morning. Sam gave me 2 minutes, so for those of you that are a little bit anal, I'd say start your stopwatches now. But first, a huge welcome. On behalf of the entire Datavant gang, I'd like to thank you all for coming today. It's a real honor for us to be amongst so many friends, colleagues, partners. The truth is, there'd be a lot more here. The fire marshal ultimately said no more. And we had to start turning people away. We're really excited about everybody's engagement in this room, and frankly, the people who we had to say maybe next year too. Look, I think everybody gets that powering every health decision with comprehensive, complete data will power one of the biggest advancements in healthcare of our generation, like on par with the big things, on par with imaging, vaccines, antibiotics, even the genome. That the opportunity is that big, and it's right in front of us. And we're making progress, but I think everybody gets it. This is a bear of a problem. It's a complex ecosystem challenge that really demands complex and sophisticated ecosystem solutions. And our goal for this summit is pretty simple. It's to help advance the path to those solutions by bringing together the top leaders across the health data ecosystem. Over 400 government, payer, provider, industry, academic, and thought leaders, to deeply engage in the critical thinking, in the technology advancements that are amongst us and that are in front of us, and frankly, the networking required to fuel the future of health data. So I encourage everyone to take that to heart and to engage. Look, we're thrilled to have Congressman Scott Peters here to kick things off. Congressman Peters serves California's 52nd Congressional District, which includes the cities of Coronado, of Poway, and most of northern San Diego. First elected in 2012, he serves on multiple committees, the House Budget Committee, the House Energy and Commerce Committee, and the Joint Economic Committees. Throughout his career, Congressman Peters has been a real champion of making healthcare more affordable and more accessible for families. Part of his work has included ensuring that San Diegans have better access to affordable care, ensuring that we as a country are investing in technology and treatments that advance health, strengthening the power, if you will, and the viability of our healthcare workforce, and championing better care for our seniors. So with that, hopefully it's at 2 minutes, but I just say please join me in welcoming Congressman Peters.
All right, good morning, everyone. How about that fire marshal using data against you? Thank you, Pete. It's a pleasure to be with you all here today. And the world is very different now from what it was in 2019. We're still dealing with the impacts of COVID-19. Much of our society has returned to some sense of normalcy, but we've learned a lot, and we've yet to learn a lot. I've got some remarks here I want to go through because I don't want to forget anything, but I want to say a couple things about how important what you're doing is today. In government and in politics, we talk about owning the future. And the people in this crowd understand a lot more about the future of healthcare than I think the people that you're going to find around here. So don't be discouraged if people don't get it right away. At the beginning of the pandemic, I talked to some folks in my committee, the Energy and Commerce Committee, which has a health subcommittee and is a committee of jurisdiction for healthcare. And I said, how are we going to evaluate what's really going on? How are we going to make policy responses without having good data? And no one really got it, but they get it now. I think people have come to appreciate that if we're going to make good policy decisions around healthcare, if we're going to get good outcomes in terms of patients, our access to data is really critical, and you're going to find a more welcoming, more more interest in the topic, but again, you're going to understand it a lot better than most people. So we're going to hope you have a great summit. We're going to rely on what you teach us. The CDC has acknowledged that lags in access to health data hampered the agency's ability to lead a cohesive public health response. And when the pandemic emerged, COVID-19 case reporting and vaccination statistics, like patient demographics or cause of death information, were not compulsory. Even today, we still cannot identify the exact number of deaths due to COVID-19 because of the existing patchwork of ad hoc data sharing agreements, data silos across the federal agencies, and the absence of certain established health data standards. These shortfalls left healthcare providers and policymakers in the dark as we work to tackle a novel virus, once-in-a-century virus. Now, San Diego, I'm really proud of San Diego. We're a big health sciences center. We're home to a fair share of health expertise from our academic institutions to our strong biotechnology sector. But when COVID hit and we needed PPE, the County of San Diego feared missing out on these important federal resources because data on case counts wasn't reflected quickly enough. The federal government did give decision makers at the CDC a variety of new and valuable data authorities through the public health emergency. But the reality is this: when push came to shove, our public health community couldn't access and leverage the data they needed quickly enough to respond effectively. Now, as I look to the end of this year and toward next Congress, I remain committed to ensure that we continue to modernize our health data systems and capabilities. But I want to emphasize that we're going to need you to make sure we get it right. We're going to need the input from all of you to make sure you get it right. You've got good representatives here in Washington, D.C., but I'm going to ask you to be engaged with your own Congress members to let them know why this is important and how it can work. And I hope that the summit produces a lot of information, not just for you, but for us. I've long championed efforts to reform and improve health data at the federal level. Now, the United States is one of the most technologically advanced nations on the planet. Our healthcare system doesn't need to settle for the status quo. To that end, we've worked successfully to secure tens of millions of dollars in federal funding through the appropriations process in support of the CDC's Data Modernization Initiative. These funds have already been used to create new pathways for COVID electronic laboratory reporting. We've also got funding for CDC's Data Modernization Initiative. That funding has massively increased the number of healthcare facilities that can now use electronic case reporting. Before the pandemic, only 187 facilities were capable of electronic case reporting. That number has now surpassed 13,000, 187 to 13,000. That means that more than 13,000 facilities can finally get rid of their fax machines, and instead they're choosing to share their data with public health entities seamlessly, efficiently, electronically, and while preserving patient privacy, which I know is an emphasis here today. I also worked to secure a recommendation from the Appropriations Committee for $5 million in fiscal year 2023 in the HHS Appropriations Report to support the Office of the National Coordinator for Health Information Technology in conducting fast healthcare interoperability resource standards, development, maintenance, testing, and implementation. There's got to be some terrible acronyms in there, a lot of capital letters. But if that recommendation is sustained, this funding will enable faster and more effective interoperability across the healthcare system, which for years has been a priority for policymakers and leaders in the private sector. And I'm proud of the work we're doing to improve interoperability. As we make further advancements in that, we need to make sure that we're filling in other existing gaps, like providing for the interoperability of provider notes, diagnostic imaging results, care plans, patient discharge documents, and more to ensure that patients can maximize the value they extract each and every time they see a provider. In turn, our healthcare system will be able to enjoy the benefits of more informed public health and provider communities who can make better data-driven decisions. I also helped to secure the inclusion of $50 million in this year's appropriations bill to support the CDC's National Center for Epidemic Forecasting and Outbreak Analytics. Really got to come up with some acronyms here. These will be terrible acronyms, not enough vowels. National Center for Epidemic Forecasting and Outbreak Analytics, that center is working already to fuse next-generation public health data with cutting-edge modeling techniques, accelerate decision makers' access to health data in real time, and facilitate innovations in the practice of public health forecasting. COVID-19 exposed the weaknesses of our public health surveillance system and the data infrastructure that supports it, and it also affords now an opportunity to use the existing structure that supports the federal statistical system to quickly stand up a unified national data strategy. Again, you're going to tell me how to do that. As many of you are probably aware, Congress passed the Evidence-Based Policymaking Commission Act in 2016. That law charged 15 experts appointed by the President and Congress with carrying out a comprehensive study of data sharing practices, including statistical protocols related to federal policymaking. Then in 2019, the Evidence Act was signed into law and codified most of the committee's recommendations, including those related to modernizing privacy protections for evidence building and using existing governmental infrastructure and expertise to ensure that data linkages and access to confidential data are conducted in the most secure manner possible. However, as I've discussed, and as the pandemic has shown, these steps are not enough, and that's why I reintroduced the Bipartisan Health Statistics Act in February 2021. I'd really like you to take a look at this legislation again. It would build on the Evidence Act to rapidly assemble decentralized data systems that can inform our nation's real-time response to COVID-19, as well as future public health emergencies. The Health Stats Act also contains language which would carve out $100 million to pilot a data linkage demonstration program to facilitate statistical public health research and identify trends across relevant populations with an emphasis on linking data related to the social determinants of health. The pilot program to support data linkages would provide for funding to assist researchers in assessing, connecting, and leveraging de-identified data sets in order to better understand the relationship between health outcomes and factors like food insecurity, housing instability, transportation access, as well as race and ethnicity. And the Health Statistics Act would do all this while protecting end-user privacy to the greatest extent allowable under federal law. Let me talk about some of the benefits for patients and providers. Because while strengthening the public health system, data system is vital as we continue to respond to health crises like COVID and monkeypox or mpox, health data is also critical to the day-to-day integrity of our healthcare system in general, and whether it's patients seeking lab tests, the prescription of a drug to treat a particular health condition, or someone receiving home monitoring services, we have countless healthcare encounters every day, and each is generating unique data points, and we need to ensure that researchers can access this aggregated, anonymized data. In-depth study of this information can provide us with important data gathered in the real world about the efficacy of potentially life-saving cures and therapies. So a timely example of this is the deployment of tecovirimat, I call it TPOXX, right? In the current fight against monkeypox. Although providers are already prescribing the antiviral, there is currently no human data proving the efficacy of TPOXX in treating mpox. The distribution of TPOXX presents an opportunity to lean on the power of health data through a collection of real-world data and the application of real-world evidence. TPOXX may ultimately prove effective beyond just small samples or beyond anecdotes, but at this point we can only gain these kinds of insights if scientists and statisticians are empowered to conduct real-world analysis. So we have to strive to collect health data while encouraging and incentivizing the adoption of privacy-preserving technologies by researchers, aggregators, enterprise data warehouses, patient registries, and public health agencies. When Congress passed and President Clinton signed HIPAA, it revolutionized our collective conception of patient privacy. But as you all know, HIPAA predates most of the digital and online services. It doesn't necessarily cover data that patients collect through wearable fitness rings, devices like Apple Watches or MyFitnessRing, which has a lot of steps on it already today because I got lost on the way over here. I know that there are several paths forward on revamping the health data's privacy protections. But I also know that when it comes to deciding on the best path, I will look forward to you all on Datavant's membership for your expertise on how we can establish new 21st century standards for the protection of health privacy data, which meet the moment in which we find ourselves, including the opportunities for additional data and for consumer access to that. Moving forward, we have to be a step ahead of any potential new virus or disease, and we can't let limitations of existing public health data systems hinder us as they did with COVID-19 and now potentially with MPOX. We can avoid these issues in the future with sound and practical legislation, as well as common sense health data standards. So for now, our work must continue, both as policymakers and as health data practitioners, to meet tomorrow's challenges. With your help, that's exactly what we'll do. I hope it's a great summit for you. I hope you have a great time in Washington, and hope you can teach us a lot about how to make sure we get this right as a nation. Good luck.